So I've heard you talk a little bit more about disability and thinking more about how the OA might be affecting the dog's ability to do things, rather than the owner being expected to pick up on pain, because dogs don't show pain the same way that people do.
That's right, and they are not essentially not vocalizing, and they're not even always limping, and that's kind of what the owners were going to be looking at. Yeah, so the reality of the situation that we run into in primary care is that on these casual visits, we may get a report of some behavior differences, kind of a loss of abilities. They're not doing things quite as well or quite as much as they used to, and yet the owners will say, but thankfully, not in pain, right?
Yes.
Because they're not vocalizing or even limping. So we have to recognize, and kind of the way to wrap, I think, our mind around it, even our own mind, but to convey to clients, I think, is to convey it in the same way that you might a person that needs a little bit of help. If we have to help a dog up onto the couch, how is that any different than helping grandma in and out of a chair? It is no different. It is osteoarthritis. It is, however, a progressive disability. That is what we're seeing, and that's how we actually kind of try to not only recognize but assess and score osteoarthritis in dogs, is through looking at those disabilities, those changes in behavior, the loss of normal activities of daily living. So disability is kind of a key word, and will resonate with pet owners, I believe, at least in my experience, better than actual pain. They don't see it.
I agree completely. And my experience talking about pain with pet owners was difficult, because if their dog's not vocalizing, whining, or licking,
Or limping,
then they may not understand that the dog is in pain, exactly as you said.
correct.